30,000 people a year will have an out-of-hospital cardiac arrest. So that could be you, a friend or a relative in the supermarket, at the pub, or at home during Sunday lunch. Now, at the minute in the UK, you have a less than 10% chance of surviving a cardiac arrest. And the most important intervention that we can do is starting CPR as soon as possible. And this will greatly increase the odds of survival. And we know that for every minute of delay that there is in starting CPR, the person's chance of survival plummets. Now, whatever the cause of the cardiac arrest, it was probably quite a catastrophic event. And so the person is still likely to die. But actually doing CPR keeps the reaper guessing just for that little bit longer. And of all the cardiac arrests that I've been to in 12 years as a paramedic, most of those have died. And most of those had had no CPR before my arrival. People might not want to start CPR because they're worried about hurting the person, about doing it wrong, about catching a disease from doing mouth to mouth. Now, in cardiac arrest, the person is effectively dead. So rest assured that if you do CPR on them, you will not make them any more dead. The most likely thing to happen is that you break ribs. Now, I would rather wake up with a sore chest than wake up dead. If you don't want to do mouth to mouth, because let's face it, it's a fairly vile prospect, then just do chest compressions. This is entirely appropriate. There isn't actually any compelling evidence that doing mouth to mouth really enhances the efficacy of bystander CPR, but that it probably puts a lot of people off even attempting it. In fact, compression only CPR might actually increase the person's chance of survival in the first place. So here's a scenario. You're in a supermarket. You see someone collapse. What do? So the first thing we do is check for danger. There's no point getting yourself killed or seriously injured. So remove the danger, remove the person from danger if it's possible and it's safe to do so. Does the person respond to you? So shout at them, give them a command, squeeze the top muscle of their shoulder and do it hard. We're looking for any kind of response. Do they flinch? Do they grunt? Do they move? Do they get up and walk away? If the answer is no, we shout for help and we ring an ambulance. Because an ambulance will not magically appear, you'll be waiting at least 10 minutes or longer if you're in the sticks, and until then it's just you fighting death. Check and open the person's airway. Remove any obvious obstructions like baguettes or pieces of sausage roll or loose dentures. If there's vomit in the mouth, turn the head to the side to drain it. Then tip the head back and lift the chin. This lifts the tongue off the back of the throat. So let's put that into practice. We'll do those first couple of bits now. So there's no danger. Hello, can you hear me? Open your eyes. So the person's not responding. Hello, shout for help. Help! I'm going to ring an ambulance. I'm going to put my phone on loudspeaker so that I can do CPR and interventions whilst I'm on the phone. Having a quick look in their airway. If there's vomit, I'm going to tip that out. I'm going to tilt their head back and lift their chin. And now I'm going to check for breathing and signs of life. So I'm listening for up to 10 seconds. Can I see their chest rising and falling? Can I feel any breath on their chest? And are there any signs of life? Are they moving? What's their colour like? Because actually a person in cardiac arrest will look dead. They look a horrible colour and you'll know immediately that something's not right. If they're not breathing, or they're not breathing normally, so when I say not breathing normally, if they're just doing the odd gasp, so imagine a guppy fish breathing like this, then start CPR because they're probably having cardiac arrest. Now, during the current pandemic, we need to put something over their face to reduce the chance of droplet formation in aerosol. So in my case, I'm just going to use this pillowcase left over from Christmas. Okay, so now I'm going to do CPR. So my hands in the middle of the chest, fingers locked together, elbows out straight and back straight, and press down hard and deep about twice a second. And you don't have to do mouth to mouth. I never have and probably never would. There is a pandemic on and CPR normally makes them vomit, as I've already said, so that's a good enough reason for me not to do it. And keep going. Only stop when the ambulance crew arrives and they're ready to take over. The other time you should stop is if the person starts breathing for themselves, or if they thank you for your service and get up and walk away. And trust me, they won't do this. or if you're too exhausted to continue, because this is really, really hard work, even just after a couple of minutes. So just keep going. You will probably break ribs if you're doing it properly. It feels disgusting, but just keep going. This is the person's best chance of survival. So in summary, check for dangers and remove them if possible. Check for a response. If they don't respond, get help and call an ambulance. Clear and open the airway by doing a head tilt and a chin lift. Check for breathing and signs of life. If neither are present, start compression-only CPR. Press deep and hard in the centre of the chest twice a second. And just a reminder, the person is effectively dead. You cannot make them worse by doing CPR. Witnessing a cardiac arrest and doing CPR is distressing, so it's okay to feel the way that you feel afterwards. Some people will experience post-traumatic stress as a result of it, and if you find yourself having nightmares, you're really anxious, or you've got really strong feelings of guilt that affect day-to-day life, you need to speak to your GP.